We've just heard an update on the KEYNOTE-45 trial. So KEYNOTE-45 was the randomized phase 3 trial comparing Pembrolizumab with essentially a dealer's choice of chemotherapy in patients with advanced urothelial cancer who'd previously received platinum-based chemotherapy. So it's essentially a second-line trial in urothelial cancer, bladder cancer. The trial was designed to compare Pembrolizumab with a choice of either vinflunine, docetaxel or paclitaxel chemotherapy. It had co-primary endpoints, but we've had the update on the outcome data from this trial with 27.7 months follow-up now. The trial was actually published a year ago, so we've got considerably more follow-up now. The trial's still positive. The thing that's exciting about immunotherapy in general terms is that it appears in other diseases where we've been using these drugs for longer, like melanoma being the classic example, that there's a subgroup of patients who get profound benefit. So in melanoma, where we've been using ipilimumab now for in excess of 10 years, we've actually got 10-year follow-up. And there's probably about 20% of patients who are still alive 10 years later. And of course, we never really see that with cytotoxics. Now, it's too early to see that kind of effect in any of the bladder cancer studies. But KEYNOTE-45 does now show at least a persistent separation of the survival curve. So at the two-year point now, we have 27% of patients on Pembrolizumab are alive compared with 14% on the chemotherapy arm. So there's a significant separation of the curves there. And it certainly looks like that's at least in keeping with that separation continuing. So it may be that we are genuinely going to see now a subgroup of patients who, though not cured, actually are going to become long-term survivors after second-line treatment. At the moment, this trial is the only positive randomized phase 3 trial of a checkpoint inhibitor in urothelial cancer. So there are plenty of other data out there, and indeed there are other products that have marketing authorizations in other indications. But I think this clearly sets, to my mind, Pembrolizumab as the defined, I would say it's now the defined standard of care in patients who've had previous platinum-based chemotherapy for advanced disease.